Why are there not more people talking about those tiny specks or strands drifting across your field of vision? These little shapes can be quite distracting, especially when you're trying to focus on something. These are commonly known as eye floaters. They are small, shadowy shapes that can appear as dots, lines, or even cobweb-like structures. While they can be annoying, they're usually harmless and a normal part of aging. As we get older, the vitreous or gel-like substance in our eyes starts to liquefy and shrink. Eye floaters appear in different shapes and sizes. They can be small and barely noticeable, or larger and more prominent. Some people see small dots which can look like tiny spots of dust floating in the air, while others see squiggly lines which can appear to move or drift as you shift your gaze, rings or cobwebs. These shapes can sometimes be quite intricate and complex. They are more noticeable when you look at a plain, bright background like a blue sky or a white wall. This is because the contrast makes them stand out more. While most eye floaters are benign, in some cases they can be a sign of a more serious eye condition. It's important to be aware of any sudden changes in your vision. Therefore, it's important to understand what causes eye floaters and when to seek medical attention. Knowing the difference can help you maintain good eye health. In this essay, we will delve deeper into the world of eye floaters, exploring their causes, symptoms, and when it's crucial to consult an eye doctor. Stay tuned to learn more about this common yet fascinating phenomenon. Eye floaters are tiny objects that cast shadows on the retina, the light-sensitive layer at the back of the eye. These shadows are what we perceive as floaters. Floaters are actually located inside the eye in a gel-like substance called the vitreous humor. The vitreous humor fills the space between the lens and the retina, helping to maintain the eye's shape. As we age, the vitreous humor can change. It may shrink slightly and pull away from the retina. When this happens, microscopic fibers within the vitreous can clump together, forming the floaters we see. The floaters themselves are made up of collagen fibers. These fibers are usually transparent, but as they clump together, they can become more opaque, casting noticeable shadows on the retina. The movement of floaters is also due to the nature of the vitreous humor. The vitreous is about 99% water and 1% other substances, including collagen. This gel-like consistency allows the floaters to move freely within the eye, drifting along with your eye movements. When you stop moving your eyes, the floaters may continue to drift for a short time before settling. Section 4. Why do we see floaters more in certain conditions? Floaters are more noticeable in certain conditions, such as when looking at a bright, uniform background. This is because the contrast between the bright background and the darker floater shadows is more pronounced. The size of your pupil also plays a significant role in floater visibility. When your pupils are dilated, more light enters the eye, making the floaters more visible. This is why you might notice floaters more in dimly lit rooms or when your pupils are dilated after an eye exam. Additionally, environmental factors like lighting conditions can affect how prominently you see floaters. For instance, stepping from a dark place into bright light can make them more apparent. Furthermore, as we age, the vitreous humor in our eyes continues to change. It becomes more liquefied, and the collagen fibers within it are more likely to clump together, leading to a higher number of floaters. This natural aging process is why older individuals often report seeing more floaters. Understanding these factors can help you better manage and anticipate when floaters might be more noticeable. So, next time you see those tiny specks drifting across your vision, remember, it's a common experience influenced by various conditions. By being aware of these factors, you can better understand why floaters appear and how to manage their visibility in different environments. On Section 5, blue field entoptic phenomenon, not just floaters. While eye floaters are the most common type of visual disturbance, there are other phenomena that can cause similar symptoms. One such phenomenon is the blue field entoptic phenomenon. The blue field entoptic phenomenon is characterized by the appearance of tiny, bright blue dots that dart across the field of vision. These dots are not floaters but are actually white blood cells moving through the capillaries in front of the retina. The blue field entoptic phenomenon is most noticeable when looking at a bright blue background, as the blue light is scattered by the white blood cells, making them more visible. It is a normal physiological phenomenon and is not a cause for concern. Section 6. When to seek medical attention. Most eye floaters are harmless and do not require treatment. They are often just small specks or cobweb-like shapes that drift around in your field of vision. However, in some cases, floaters can be a sign of a more serious eye condition, such as a retinal tear, which is a tear in the retina that can lead to retinal detachment. Retinal detachment, which is a separation of the retina from the back of the eye and is a medical emergency. And vitreous hemorrhage, which is bleeding into the vitreous humor and can be caused by various factors, including diabetes and high blood pressure. These conditions can lead to severe vision loss if not treated promptly. If you experience any of the following symptoms along with floaters, it is essential to seek immediate medical attention. Sudden onset of a large number of floaters, flashes of light in your vision, a curtain-like shadow spreading across your field of vision, and eye pain. These symptoms could indicate a serious problem that needs urgent care. While most eye floaters are benign and a normal part of aging, they can sometimes be a sign of underlying health issues. It is always best to err on the side of caution and consult an eye doctor if you have any concerns about your vision. Regular eye checkups can help detect problems early. By understanding the causes and symptoms of eye floaters, you can take proactive steps to protect your eye health. Stay informed and take action when necessary to ensure your vision remains clear and healthy. Thank you for watching. If you found this video helpful, please like and subscribe for more content.